we just published a paper about 2 months ago now, looking at what the anticipated outcomes for spine deformity surgery is. And what we found is that it varies based upon the spine deformity type. So just like within spine and spine pathologies, there are different problems or disease states within spine, right? There's disc herniations, there's spinal stenosis, there's spine deformity, there's non-union, there's tumor, there's iatrogenic deformity. But even now, as we distill it even further within spine deformity itself, there's different types of deformities. There's isolated thoracic scoliosis, there's lumbar scoliosis, there's sagittal malalignment, there's mixed deformities. And what we found is that patients that have different types of spine deformities have different types of self or health deficits. Then we were also able to find that the improvements for those different types of spine deformities differed by the spine deformity. So the improvement that the isolated thoracic scoliosis is very different from the improvement from a sagittal mixed deformity. So what is that telling us? It says that, say, for the isolated thoracic scoliosis, the scoliosis that goes into adulthood, pain and physical function were not large components of their health deficit. Self-image tremendously was. And we could impact that so much so that over 90% of patients with isolated thoracic scoliosis had a return of their self-image to normal, which is fascinating, right? Because what we do to the spine, it's probably not normal. We can make the spine straighter and spine deformed, but it's not a motion segment any longer. They're fused, but their self-image went from massively impact to normal, but their physical function didn't change very much. So again, what is that telling us? It's telling us that the patient with isolated thoracic scoliosis that wants to have surgery to improve their physical function probably is not in the wheelhouse for this. Whereas if they want to improve self-image, then this surgery will be effective. And I guess the next question, what is that telling us, is we need to be able to identify what the health deficits are so that we can then prognosticate to see if surgery fits for them and tailor make their fit for them and their treatment. And so I think that the sum up answer to that question is identifying what patients want, how can we positively impact them, and then can we deliver that in the safest environment possible.